Hi, everybody, and welcome to ALZ Talks, the Alzheimer's Association offering to bring the latest in caregiving, disease-related information, and today, research and treatment to you. Thank you so much for joining us. The Alzheimer's Association is leading the way in creating a world without Alzheimer's and all other dementias. And so we're here for you whenever you need, 24/7. We have our helpline, and we have amazing individuals like the people you're going to hear from today who are connected to our mission. Thank you again for joining us. And I also want to thank our sponsors. This is brought to us today by Procter Gamble, but created by the Alzheimer's Association. So thank you to them. So first up, I'm going to introduce our featured presenter, Dr. Heather Snyder. Dr. Snyder is a senior vice president for the Alzheimer's Association, and she works in our medical and scientific relations department. Heather has her finger on the pulse of what is happening in Alzheimer's and all dementia with regards to research. And thank you so much, Dr. Snyder, for being willing to share with us an update about treatments. And I know there's a lot that's been happening, so we can't wait to hear from you.
No, thank you so much. And it's an absolute privilege and pleasure to be joining my fellow panelists today for this discussion and for, as we think about the landscape and where we are and where we're going today. And so I'm hoping everybody can see my slides, and I will just start. These are my disclosures. I'm a full-time employee of the Alzheimer's Association, and then you can also see the Alzheimer's Association's disclosures listed here as well. So where are we in our understanding about Alzheimer's disease, our understanding around how this has been feeding into the research? And over the last several decades, with the incredible infusion of investment at the federal level, but also with the investment of the Alzheimer's Association as the world's largest nonprofit funder of Alzheimer's and dementia science, we now understand that Alzheimer's disease is a continuum, that actually the underlying brain changes are starting decades before someone experiences the memory changes. And that gives us a window in when we can actually say, what are those changes, and can we measure those at an earlier time point, and can we intervene and change that course for an individual? Today, there are tools called biomarkers that are these reliable predictors of that underlying biology. They allow us to measure those brain changes. Examples of biomarkers you might be more familiar with are glucose, for instance, as a measure of insulin resistance, or diabetes, or cholesterol is often thought of a biomarker of changes in your heart health and your as a marker of heart disease. There's lots of potential uses for biomarkers. They can be used to improve or enable diagnosis. They're being used in clinical trials as a way of identifying the participants that may benefit from a given treatment. They may determine someone's course of their disease, or they could potentially predict who may have certain outcomes with a given treatment or particular side effects. So lots of uses of biomarkers and these tools. And for a long time, our brain is a very protected organ. It is and you really can't take a look at what's going on inside in a living individual. But over the years, we've come an incredibly long way in our ability to actually understand what's happening in the brain at some of those earliest time points and throughout that progression. For instance, the fluid that our brain is bathed in is called cerebral spinal fluid, or CSF. And it was really in the late 1990s that it became clear we could use this as a window into what was happening in the brain. In the mid to late 2000s, really through the 2010s and all the way through even today, the ability of using PET imaging as another tool of being able to look at what's happening in the brain and detect some of those brain changes associated with Alzheimer's disease, but also other diseases that cause cognitive impairment and dementia. And more recently, there's been incredible progress on blood tests and using blood tests as a much more accessible tool. Now, none of these tools should be used in isolation. They're really part of that clinical workup to understand what may be causing a person's memory changes at that earliest time point when someone is experiencing those changes, and then using that as a way to understand what may be happening for that individual. Now we've come a long way, and in fact, just a few weeks ago, the first blood test used in diagnosing Alzheimer's received clearance by the FDA. Now, this is testing a very specific ratio of two different things in the blood of individuals that have cognitive and functional changes. It's not to be used looking at risk or for individuals that do not have symptoms, and it is expected to be used based on the FDA clearance by specialists. Now, this is just one of the many tools that are in development going forward, and it just is the first to receive this FDA clearance. Now, clearance does not always mean coverage, so that's a different discussion, and how it's used in the clinic is also a really important question, and there is a need for very clear clinical practice guidelines about what a blood test may mean, who it's used for, and in what context may it be helpful in that diagnostic process. So a lot of work going on right now on that. And in fact, the Alzheimer's Association has an incredible group of global experts that are developing clinical practice guidelines, and they'll be sharing them, the final guidelines, at the Alzheimer's Association's International Conference this summer, setting that bar for how and where these types of blood tests can be used in that diagnostic process. There's a lot of benefits for an early and accurate diagnosis. I think for many of us, understanding what's happening to yourself and understanding what may be the cause of your changes in memory, thinking, and reasoning. There's, of course, medical benefits, access to current treatments, the ability to participate in clinical trials, but also prioritize your overall health, including maybe lifestyle or behavioral changes in your day-to-day life. But again, that understanding or thinking about end-of-life decision-making, planning for your care and financial future as well. And we also know that if you understand or you have an early diagnosis, there's a benefit if you have another disease such as diabetes, in managing that reduces some of the negative consequences that some people may experience if they're not properly managing their diabetes, as an example. Now, in the Alzheimer's space specifically, we have a number of FDA-approved therapies, and they really make up three different types of therapies, if you will. Those that are here in orange, they have been approved to treat the symptoms. So there is no evidence that they are stopping or slowing the underlying changes that we see in Alzheimer's disease. We have two recent treatments, and I'm going to talk about these in a second, that really are targeting the mood or behavior. So while we talk more about the changes in memory that people with Alzheimer's experience, there are other changes, there are other non-cognitive symptoms that an individual may experience, including changes in their sleep, increased agitation. And so having ways of supporting individuals and treating those symptoms is also of benefit. And then the most recent, newest class of medications that we've seen come to fruition are those that are targeting the underlying biology, with an expectation that they slow disease progression, they slow the changes in cognition and function and behavior change for an individual. Now, 4 of these were only approved in just the last few years, 2 of them that are targeting that underlying biology, and 2 of them that are targeting those non-cognitive symptoms, such as agitation for individuals. I'm going to talk more detail about the 2 that are targeting the underlying biology as we see this landscape changing so significantly in the coming years. Now, when we look at that progression or that continuum that we started with today, the 2 medications, lecanemab and donanemab, that have been approved by the FDA are specifically approved for individuals with MCI due to Alzheimer's disease or mild Alzheimer's. And according to the labels, is that they are for individuals age 50 to 90, and donanemab was tested in individuals age 60 to 85 with mild cognitive impairment due to Alzheimer's or mild Alzheimer's dementia, with evidence of the brain changes that we see in Alzheimer's disease. Now, both of these have been approved by the FDA. They both specifically target beta amyloid, one of the hallmark brain changes that we see in Alzheimer's. But we also know that in Alzheimer's, there's other brain changes. There's also accumulation of the tau protein into the tau tangles. There's changes in the immune system and the inflammation pathways. There's changes in how the brain cells are communicating to one another, as some some examples. And so while these are our firsts and incredibly exciting milestones for our field, they are also just our firsts. And we as a field are continuing forward with looking at all of that changing biology that we know is happening in the brains of individuals with Alzheimer's, and advancing potential treatments or targets to treat those changes. So of course, beta amyloid and tau, that cell-to-cell communication, how the brain cell is regulating and making its energy, as just some of those examples. Now, when we dive into this a little bit more, what we see in the current pipeline is this changing number of clinical trials. We see a number of things that are in phase 3, phase 2, and phase 1. All of that is that pipeline of looking at safety in phase 1, looking at safety and potentially the dose or the regimen for individuals, and then phase 3 really asking that question of, is receiving a treatment more beneficial than not receiving the treatment? And one of the really exciting things that we're seeing in a recent report that looks at and marks year over year the advances in the clinical pipeline is that we see a tremendous increase in the number of phase 1 clinical trials. And that's because of the investment that with our federal dollars, with funding from the Alzheimer's Association, we have a greater understanding of the biology of Alzheimer's. And that is now translating to potential interventions that are moving into clinical trials, that really being tested for the first time in this population. So seeing almost a doubling is really exciting to see that progression. Today, there's 138 unique therapies in over 180 clinical trials for Alzheimer's disease, and 33% of them are what we call repurposed, meaning that these are drugs that were developed for other diseases, but have biology that is relevant in Alzheimer's. And of those, 74% of them are targeting the underlying disease, 14% are looking at benefiting the cognition for individuals, and 11% are looking at those behavioral changes that we talked a little bit about. So when we drill into this a little bit more, we also see this real diversity of what's moving into the pipeline. 22% of them are looking at what we call neurotransmitter receptors. That's really the cell-to-cell communication, how the brain cell is communicating to other brain cells, and how it is activating some of the signaling. If you go back to your Bio 101, some of the signaling activities that are so important in our brain's every function. 18% of them are related to the biology that we see in Alzheimer's, 17% related to the immune system changes that we see in disease, 11% related to tau processes and that tau accumulation that we see, and then 32% related to other biology, other mechanisms, and all of that's moving into the clinical pipeline. So while all of this is incredibly exciting to see that progress and see that momentum, we also know these are, and I've primarily been talking about drug-related interventions. There's a wealth of research that's going on in behavioral or other types of interventions for individuals that may be at increased risk, for example. And one of those is called the U.S. Pointer trial, which is was ongoing in 5 sites around the country, evaluating an intervention in over 2,100 individuals. The intervention took the best information that we had in science around what might be those behavioral activities that may benefit our brain health in an at-risk population. The 2 interventions, self-guided and structured, were tested over a 2-year intervention to ask, does this benefit cognition, and what is that consideration in these individuals? Now, this trial is coming to its conclusion, although we look forward to continuing to follow the participants. And in fact, we expect to report the top-line results at AAIC, the Alzheimer's Association's International Conference this summer. And a part of that, on the Thursday, July 31st, is an opportunity for all of us to participate in sessions and learn the latest in research that's coming out of AAIC, which is the world's largest dementia scientific conference. And that will include the top-line results of US Pointer. Now, taking all of this together, if we look at Alzheimer's disease, we know that there are a lot of different brain changes that are happening across that continuum. There are changes in the amyloid and the tau, but also the immune system, the cell-to-cell function, the vascular system, just to name a few. We have increasingly tools such as the cerebral spinal fluid that our brain is sitting in, imaging tools like PET imaging, but also more coming down the pipe is tools around blood and measuring plasma to actually know, well, what are those changes that an individual is experiencing, and can we use that for early and accurate diagnosis? And as this landscape evolves of therapies, we have better tools that may enable us to actually target the specific biology that an individual has changed in their brain. And we can pair that with different risk interventions for individuals across the board. And it's really this whole landscape where we are as a field, and we're moving forward across the board. And it's this advances in treatment, both those our firsts, our newly approved medications, but then also this larger landscape of what's coming in the very near future. So huge thank you to all of you, and I'm really looking forward to our discussion with the panelists today and hearing more about their perspectives. So back to you, Elizabeth.
Wow. Heather, that's incredible. I loved that summary where you showed all of the different avenues of research and things that have been happening and really making a difference in people's lives. I'm curious, before I go to our panel, so is there anything in particular that you're most excited about coming up? Some studies you're expecting to hear from? You mentioned US Pointer. We're going to hear that. What are you eager to hear more about from trials or any of the research that you've been following?
Well, of course, at AAIC every year, we hear so much of the latest and what's happening across the clinical trials, also, perhaps new things moving into trials or coming soon, as well as the advances in some of the diagnostic tools, things like blood and that work, particularly as we think about some of the other diseases that cause dementia. We also know that later this year, there are 2 large phase 3 studies that are anticipated to report out, and they're looking at a novel mechanism or a novel approach that is looking at GLP-1 agonists. So semaglutide, it's a different formulation, it's an oral pill, something, and I know this has been a headline, a lot of news around semaglutide and these GLP-1 agonists, but they're also being tested as a potential treatment in people with Alzheimer's disease because of their anti-inflammatory and other mechanisms. Now, we look forward to, we don't know what that's going to mean. They're being tested. And so that's really why the trials are so key, is to really tell us, is this an effective treatment? And we look forward to seeing those report out by the end of the year.
Very interesting. Thanks so much. Really appreciate it. Now, it's so interesting for us to hear all the amazing things happening that Dr. Snyder was talking about, treatments, and ultimately the whole point is to get them into people's hands and to have them make a difference in their lives. And now we're going to shift gears, and that's what we're going to talk about. And we have 3 wonderful panelists who I have the great good fortune of getting to work with. I'm going to start with Brent and Kathy Rigby, who I've gotten to know through our early stage advisory group. Kathy is one of the spokespeople on our early stage advisory group and has been with us for the past year. And Brent is her care partner, and they are bi-coastal kind of people, California, Florida, and some other places too. So glad you could be with us today. I'd love to start and Kathy, really talk with you about, when you were diagnosed and you were trying to figure out, share with us, what was it like for you? How did you decide which pathway you were going to take with regards to treatments?
Well, I had the symptoms, and there were 3 symptoms. So the stuttering, that was kind of, I'd never stuttered before, and all of a sudden, not all of a sudden, I noticed it like within a couple of years, I just changed. And I got really anxious, kind of crying, and Brent would say, "What's wrong?" And I have no idea. I just felt scared all the time. And then I would lose concentration very easily. And I would just, somebody interrupted me, I just couldn't come back or anything. So we went to our family doctor, and our family doctor was really good. And he said, "I'm going to send you to a neurologist." Unfortunately, we did not have really good actions with our neurologist. He didn't really seem to really know, but he did actually refer me to a clinical trial study. And in that, I kind of thought, gosh, this is kind of weird. What's going on? Because nobody had told me anything. So we
Oh,
go
they
to
didn't tell you had a diagnosis?
nothing. The neurologist, all that he did was did a PET scan.
No,
Oh, I'm sorry. What would he?
did an MRI.
MRI. I'm sorry, MRI. And the MRI showed that I didn't have any damage done to my brain. So I hadn't fallen or, that kind of thing. So he, without further testing, he just sent us to the clinical trial.
Oh.
It was there at the clinical trial that I asked the doctor, I said, nobody said anything, but do I have, and I just put it as, do I have the A word? And he went, yes, you do, Kathy, you have Alzheimer's. And it was really, I had always been healthy. I don't smoke, I don't drink alcohol, and I'm just really, that's what I've said before, that I'm prideful, that I'm healthy, kind of thing. But when he explained what that was and how we needed to decide what to do quickly, because almost every day is critical. And he said with the drug that I would be put on, donanemab, now called Kisunla, that there's a possibility that I could have a brain bleed. And that was an issue. But at that point, I thought my husband's sister-in-law passed away from it, having Alzheimer's. And I got to see personally, I'd never seen anyone with Alzheimer's really. I got to see her dwindle away to nothing. She wasn't the Angela we knew, and it was heartbreaking. And I thought, I don't want to die like that. I want to live. I want to know my family. I want to know who you are, Elizabeth. And I want to know that. So I had this donanemab. I had no problems with it at all. Nothing. I just feel so blessed that it took me so far. And I'm okay. I can continue. I asked the doctor, now when will it'll return? I know that. But he said, by then there might be a pill you can take. And maybe you take it once a week, maybe once a day, whatever. But I don't know. I was willing to take the risk, and I'm so glad I did. And I was in that study trial, I was only on the drug. I wasn't on a placebo.
And you got to find out. Okay.
I was on the dosage phase of it. So
wow. I'm so glad that you were referred for a clinical trial. Interesting that you didn't know why you were being referred, but perhaps it worked out in the end in terms of,
did.
So you mentioned something about, the side effect, which is, it's called ARIA, amyloid related imaging abnormalities. It's kind of a mouthful, but I'm curious, Brent, I know you talked about that, like how you guys decided, how you kind of, clearly Kathy wanted to try and do something, but could you talk about how you made that decision, how you determined that was the best way to go, both of you?
After we watched my brother's wife go through this, and my brother was blessed that he had all the financial means he would need, all the contacts, the corporate people he would need, but there was nothing he could do to help his wife at all. There's just watch her dwindle. And so we thought about that, and we thought, well, if there's a brain bleed and we lose her, that might be better than watching what Angela went through.
Gosh.
But we've also learned a lot. It's kind of like you watch these drug commercials on TV, and if you take an aspirin, it might give you a heart attack and something else all at the same time or something. And we've kind of learned that the brain bleed was something they had to warn us about, but it really wasn't as serious as it sounded. It wasn't as scary as it sounded. We got to, at the end of it, Kathy was asked to present the FDA advisory panel for approval for donanemab. So we sat all day listening to all these presentations.
Oh, wow. You got really inside Access. Oh my goodness.
Most of it we could not understand, but but as we listened, and they talked about the brain bleed, obviously, and in the whole presentation, they talked about 2 patients that may have died because of that, but they said there was really nothing that could tie it to it. So it kind of seems like brain bleed has kind of gotten a bad name with donanemab. We do know that we've met people that were on the trial study and they were taken off because they monitor really close with MRI. And if you get the slightest brain bleed, you're done.
You need to go off.
Very carefully monitored. So for us, it was an easy decision to
felt
say.
like it was the right choice.
Yeah, simple decision.
Yeah, I appreciate that. I know, Dr. Snyder, when you're talking to people, I know that we're always, it has to be the right decision for people and an important conversation with your doctor. Is there anything you would add to that in terms of, for the folks who are viewing and trying to decide would they want to pursue it? What kinds of, are there any questions or anything in particular you would encourage people to ask? How do they go about this?
I think Brent's comment is this is very personal and this is very individual and there is no right or wrong answer. It's something that you individually need to weigh and consider on the risk benefit for you. There are other considerations that may come into place, and that should be part of the discussion with the clinician. For instance, individuals that have a certain gene may have an increased risk, and so that's part of the discussion that should happen with their healthcare provider. Again, in weighing that risk benefit for the individual and for their family, and it is really part of that bigger decision.
Yeah, thank you for mentioning that. I do want to let people know, and we, Kathy and I, and Cindy's husband, Brent, on the early stage advisory group, not everyone can take these medications because of counterindications. So, and that was one of them for some of them, is they have particular gene that puts them at higher risk, or they've had other, let's say they're on a blood thinner. So we do want to acknowledge that this is really, hopefully, the beginning of different treatments and opportunities in the future where we do hope there'll be more choices and more people to be able to access different types of treatment. This is the beginning, the first treatments available, and not everybody can access or take those. So Cindy, I want to turn to you. Thank you so much for being here, and to introduce Cindy Beasley. And Cindy has been involved with the Alzheimer's Association because her husband, Dr. Brent Beasley, is on the early stage advisory group. And I've gotten to know Cindy as she's gone through quite a journey around these medications and trying to help her husband, Brent, Dr. Beasley, to access them. Cindy, thank you so much for being with us and sharing a bit about your experience. I know that Brent, your husband, Brent, was able to access treatment really early when, I believe it's Leqembi for him. When Leqembi was approved, he was recently diagnosed. Could you just kind of give us a sense of how did that go? How has that gone for you with him getting access?
Yes, so, it is a long process to get diagnosed in the first place. So it was about a year before he finally had a diagnosis. And during that year, that was in 2023, Leqembi actually came out on the market. We had been offered the chance to participate in a trial, opted not to. My husband was 57 at the time, and we felt like if there was a treatment, we would rather have access to that instead of being in a placebo-controlled trial. He had his official diagnosis in August of that year, but because we are young and have to use private insurance, we faced several hurdles in even getting it approved. So it wasn't until November that he was actually able to begin his infusions.
Yeah. One of the things that you shared was that because it was new, it was not only new to you, it was new to everybody you were working with. So how did that evolve and change over time? What did you learn through that process?
Yes, it was really interesting because it became very clear early on that there were undefined processes and unexpected hurdles to overcome, not only for us, but also for our medical office, for the infusion center. they assigned us a person to help navigate things in the medical office, thankfully. But I remember one time he jokingly remarked to me that, we're putting together an airplane in the air. So through occasional laughter, and I will tell you many tears and frustrations, this has over time become a partnership where we are working together to ensure that Brent gets the care he needs. And I will tell you that patient navigator is on my speed dial and is the first person I call when an issue arises, because they do continue to arise. It wasn't just one and done. We continue to face hurdles.
Yeah, and again, witnessing what you've gone through, it's just something I really want people to understand, that you may be getting on a roller coaster, and it makes it kind of hard because you feel like you've solved, just when you think you solved it,
right?
Your experience would say, not so fast, right? So it can be tricky. It can be tricky. What are there any particular lessons that you've any conclusions you've come through that process that you would any lessons that you would share with someone else who's going through this or thinking of going through it?
Yes, in terms of practicalities, there's so many aspects to this. If I were to offer advice to people, there are a lot of things that do not make sense. To your point, you think you've got coverage and you should just be able to move forward. And then 2 months later, they deny it, or they decide they want another test. Or maybe, when you're in private insurance, maybe your insurance changes, or you're trying to navigate COBRA. So honestly, I think, it's new territory, and the reality is treatments are expensive, so it's going to be challenged. So my first, thing that I have had to do is to accept that it's going to be hard, right? That's my starting point. I can't feel sorry for myself. I can't do those internal battles. I just have to accept that it's going to be hard and move forward with it. And for those thinking about this, I would say, I've learned several important things. One is to really stay on top of the correspondence that you get from your insurance company or from your employer, from the infusion center. You need to know what is going on at all times. If you're overwhelmed by it, phone a friend, get somebody else to take a look at those documents with you, because this is overwhelming. Get somebody else to join in with you to help you to parse it out and navigate it. If your loved one is on your insurance, you can check with your carrier to ensure that the medicine is covered by your policy. That is really important. If it's not, consider COBRA or an insurance specialist for a marketplace plan. This medicine is very expensive. You're going to need to have some support. You may also be able to talk with your employer, which I have done, about insurance needs for the future. So when they make those insurance selections, you are able to access the medicine. And leaning into your care team, any contacts that you have at the infusion center, this is really critical. You cannot do this alone. It's not a battle you can fight alone. You need to notify them as soon as possible if your insurance is changing, if you have challenges, so that they can advise and address as soon as possible. This is a team effort. I had to learn that we are not adversaries in this process. We as caregivers, it feels very emotional for us. We're watching our loved one diminish in front of our face, but we need to step back and be gentle when we can, and reach out for help. And they are there to help. Make the calls, challenge when it's needed, ask the questions even when it's hard. But again, push gently, realizing that you are the best and most interested advocate for your loved one, and without you, their voice is lost. So those are the things I've learned.
Wow. I mean, there's so much packed into that. And I know that it's come about through hard times for you and for Brent as well. I know that you both had some really wonderful good news happen recently with Brent in terms of some test results. Would you be willing to share? Like, it just seemed like maybe it was worth all that hardship.
Of course. We have been very fortunate. Leqembi for us, when Brent was diagnosed, he was spiraling, and that, for those of you who have dealt with this, the crying in your pillow at night or going into the closet to hide just because it's so overwhelming. And I remember just thinking, I'm losing him and I'm losing this relationship. When we started Leqembi, it was, I started to see some subtle changes, and it was really about at 9 months when we really, I remember he was performing a specific task and I thought, oh my gosh, he's back. And he came out and said to me, I was fully aware, fully present. I knew where I was. I knew where I was supposed to be. And it was remarkable. So Brent, because he's in medicine, when he was first diagnosed, he had to get a lumbar puncture to get his p-tau level, which is one of the diagnostic tools for Alzheimer's. So he volunteered to have another lumbar puncture, which is crazy. People don't do that, but because he wanted to see if there was any marker that actually coincided with the improvements that we've seen. And sure enough, we did this just about a month ago. And when you look at this chart, it's this beautiful chart. And at the top, you show where his p-tau ratio was, and it was very high. It was indicative of Alzheimer's. And it literally goes in a diagonal like this over 18 months to where now it is down here and it is in the normal range. So no longer, if he were to have that p-tau test now, nobody would have diagnosed him with Alzheimer's at that point. That doesn't mean it's gone, clearly, but in terms of just looking at markers and looking at what that medicine is doing, clearly changes are afoot.
Wow. Well, that's wonderful to hear. And it I think, gives us all hope, because what we want is more time and more quality time, right?
Absolutely. Absolutely.
So I want to thank you all so much for being here. And maybe we could just close with any last remarks for anyone who's watching this today, who's maybe newly diagnosed, and trying to figure out, what do I do now? If you have any thoughts on, what would you want them to know about this journey that we're on? And Brent and Kathy, I'm going to start with you. Kathy, what would you want to say to someone who's been recently diagnosed?
Get help quickly and get whatever medication works for them, because it's out there and that there's hope. And we don't have to dwindle away. We can, I got better. After I was finished with the donanemab, I got better. So, that wasn't always the case, but the sooner, the better. That saying is really profound and for me now. Just, you find something, you go out there and get something done. And there's such hope now.
Yeah.
It makes me smile.
Yeah.
There's hope.
Wonderful. Thank you. Brent?
I've learned that I need to keep an eye on things, do the best I can for her. We had a meeting with her neurologist that referred her to the study. Boy, it was a very disappointing meeting. And I learned that he really kind of had no clue of what was going on. The things, when we walked out of that room, we were like, where in the world are we? So we knew then that it was the wrong place to be. And so we started trying to look for a new neurologist. And that was so hard. Every call we made, it got no return calls. And so what I did one day is I actually just typed up a letter. And I just kind of described why Kathy would be a good patient for them. And I hand delivered to each office, and it worked. And we were able to get a good new neurologist. So what I've learned is don't take no for an answer. And there's like what Cindy Beasley was talking about, a lot of no's that she couldn't. You just keep moving on. You just stay positive and just do the best you can. Say, no, I'm going to do everything I can to get help for my partner.
I love that you hand delivered written letters about how wonderful Kathy would be as a patient. And I agree. Anyone would be lucky to have Kathy as a patient. That's amazing. I'm sorry that you had to do that, but thank you for sharing that. Cindy, how about you?
Yeah, I think, in the 18, almost 24 months that we've been dealing with this, It's all so overwhelming at first, and I echo everything Brent and Kathy said in terms of advocacy, in terms of the sooner the better, really being on top of this. And I think from an interpersonal standpoint, for me, I have found that instead of running away, what I need to do is lean into. And when I say that, I mean leaning into love for my spouse and our love for each other, leaning into our faith, whatever that may be for you. For us, it's knowing that God is with us through the good and the bad, and then leaning on friends at the Alzheimer's Association, because I can tell you these friends understand our difficulties, they treat us with kindness, and they continue to get us through.
Oh, wonderful. Thank you so much. Dr. Snyder.
Yeah, I mean, I find all of you to be an incredible inspiration and a reminder that as we are on new frontiers of treatment and diagnostic tools, you are also on those new frontiers with us. And it's really all of us together that are pushing the envelope, and we absolutely have to keep pushing. And, Cindy, I love what you said about reaching out to the Alzheimer's Association if you're in that place, so that we can work and partner together really across the board in pushing that envelope and bringing those tools, whether they be for early and accurate diagnosis, whether they be expanding the treatments that people can choose from, whether they be interventions to reduce somebody's risk or in combination therapies. And it's really all of that together that is ultimately going to be where we need to go. So huge, I'm inspired by all of you, and just thank you for everything that you do, but also sharing your story so openly and your voice to anybody that's listening and watching this today.
Thank you. Thank you all so much. And as Heather mentioned, and Cindy, you said, I do invite you all to reach out to the Alzheimer's Association. As I mentioned, we have our 24/7 helpline, and actually we are learning a lot about what it takes to be successful in navigating some of these choppy waters. Including some of what the Beasleys went through. And we have some partners out there that we're working with around how do you manage these denials. So please reach out to us, find people in your community, because it takes a village to get through this. And we are all working on this together. And someday we will have many more treatments for all the different types of dementia, and we'll be in a better place in terms of intervention. But thank you for sharing your words of wisdom and bringing us up to date, and hope you all have a wonderful rest of your day. Thanks for joining us. Take care.
Thank you.